These are the worst wound healing myths that are quietly sabotaging your recovery. You've probably heard all kinds of advice about wounds. Just let it air out. Just use Neosporin. A scab means it's healing. What actually separates wounds that heal quickly from those that get infected and take forever to heal? It's all about knowing what heals wounds and understanding the common myths to avoid. Which is why in this video, I'm revealing the myths that are sabotaging wound healing and what actually works instead, so you can implement all of this on your loved ones or yourself. By the end, you'll know the worst myths about wound healing, why they stick around, and what actually works instead. And once you understand the why, you'll never look at wounds the same way again. The first myth was one I came across a few years ago with one of my patients, Mrs. M. She was in her late 70s, living independently and sharp as ever. She came to clinic with a small wound on her shin, just a scrape from bumping a chair. But when she pulled up her pant leg, I froze. What should have been a dime-sized cut had turned into a quarter-sized crater, dry, dark, and crusted over. I asked her how long it had looked like that, and she said, "It's been healing for weeks. I'm keeping it dry and letting it breathe." There it was. That's myth number one. This idea sounds logical. We all learned as kids that scabs protect a wound. But here's the truth. Wounds need moisture, not air, to heal. When the skin dries out, new cells can't move across the surface. They get trapped under the scab like seeds under concrete. In a moist environment, those same cells slide easily, rebuilding the skin from edge to center. In other words, a moist wound heals 2 to 3 times faster than a dry wound. And it hurts less too. Mrs. M's wound had dried into a hard scab, sealing in bacteria and cutting off oxygen. Once we removed the dead tissue and switched her to a moist dressing, it started to close within a week. So no, don't let it breathe. The only thing your wound needs to inhale is oxygen through your bloodstream, not through the air. This one makes me cringe because it's so common. People see redness or drainage and think it must be infected, so I need antibiotics. But most chronic wounds aren't infected. They're actually inflamed. There's a big difference. Inflammation is part of the healing process. Infection means bacteria have taken over. Antibiotics help when there's spreading redness, heat, swelling, pain, or fever. But when the problem is poor blood flow, pressure, or diabetes, antibiotics are like painting over a crack in the foundation. They might hide the problem temporarily, but they don't fix what caused it. I once had a patient who'd been on 5 rounds of antibiotics for a venous ulcer that kept reopening. Not one provider had checked his pulses or compression status. When we finally did, his arteries were fine, but his veins weren't. So we started compression therapy and the wound healed without another pill. Antibiotics are powerful tools, but they're not wound care plans. They're seatbelts, but not the car. This one might be the most persistent. We're trained to think a scab equals progress, but in modern wound care, it's a little bit more nuanced. Yes, a scab can be a natural part of healing from minor scrapes or injuries on healthy skin, but when we're dealing with chronic or complex wounds, it's a different story. A scab is made of dried blood, fibrin, and tissue. It's the body's quick patch job like a natural band-aid. But here's the catch. In larger or slower healing wounds, that dry crust can actually block the healing process. It's like wallpapering over mold. It looks better on the surface, but underneath, nothing is fixed. Healthy healing skin is moist, pink, and slightly shiny. So if you see a thick crust scab, it often means the wound is drying out too much or the dressing isn't helping it heal. When I explain this to patients, I say, a scab is the skin's version of giving up too soon. We want the tissue to stay alive and engaged, not shut down and crust over. So no, not all scabs are bad, but in modern wound care, we're often trying to prevent that crust from forming too early in the first place. Hydrogen peroxide is one of those myths passed down like a family recipe. Everyone has a bottle at home and the fizzing feels like it's working. But what it's actually doing is killing the new fragile healing cells along with bacteria. It's like using bleach to clean a paper cut. Yes, it's antiseptic, but it's also destructive. For most wounds, gentle cleaning with normal saline or hypochlorous acid solutions is plenty. Hydrogen peroxide belongs in your cleaning cabinet, not your wound routine. We tend to measure danger by pain, but in people with diabetes or neuropathy, pain can disappear even when damage is happening. A wound can deepen silently because the nerves aren't sending the alarm. That's why every diabetic foot should be inspected daily, top top to bottom and between the toes. Because it doesn't hurt doesn't mean it's healthy. It just means your nerves have gone quiet. I've seen countless patients who came in saying, I didn't feel a thing, and left learning that the absence of pain is not the absence of a problem. This one is tricky because it's half true. Medical grade honey has real antibacterial properties and can help manage moisture. But pouring kitchen honey or worse, sugar on a wound can make things worse. Not all honey is sterile. Some types can harbor spores or irritants. And sugar doesn't bounce moisture, it dehydrates tissue. So yes, honey dressings exist, but they're lab prepared, sterile, and carefully controlled. So if you're using something from your pantry, it's not really recommended, and it's a little too risky. Healing isn't just about closure, it's about restoration. When a wound closes, that skin is still immature for weeks. It's fragile, dry, and prone to reopening. That's why follow-up, moisturization, and prevention are part of the plan. I tell patients just because the door is shut doesn't mean it's locked. That new skin needs reinforcement through compression, proper footwear, or offloading, depending on the wound type. Miss M, the patient I mentioned earlier, healed beautifully, but she still moisturizes daily and checks her legs every night because she learned that wound healing isn't a single event, it's a lifestyle. When you look at these myths together, a pattern starts to emerge. All of them are born from good intentions. People want to help. They want to do something that feels caring. But wound care isn't about doing more. It's about doing the right things for what stage your wound is at. It's about understanding what the body is trying to do and helping it, not fighting it. Because wounds aren't just broken skin, they're signals. And they're stories the body tells us about circulation, nutrition, mobility, and time. And this is exactly why I built the Wound Care Circle. Because these myths don't just confuse patients, they exhaust clinicians. We're constantly re-educating, redressing, and re-explaining. Inside the Wound Care Circle, we talk through how to bridge that gap, how to teach, how to simplify, and how to help patients heal faster without feeling overwhelmed. It's not about memorizing dressing brands. It's about seeing patterns and restoring confidence. Wound care doesn't belong to one profession. It's a team sport. And the more we learn from each other, the fewer wounds become chronic. Let's bring this back to you. If you've been told to let it air out or just use peroxide or wait for a scab, I'd like you to pause and ask, what is this wound really trying to tell me? Because healing is responsive. When you understand the science behind it, you can make small, confident decisions that have huge ripple effects. So now that you know the myths that hold wounds back, you need to actually learn how to actually accelerate healing and speed up the healing process. And there's something I've been using lately in my wound care practice that helps wounds close faster and stay closed longer, especially when the basics aren't enough. So watch this next video on the screen and I'll show you exactly what it is so you can accelerate healing step by step. Stay informed and heal well.